The Joy Business Van, empowered by Joy Business and supported by EcoBank, the Pan-African Bank.
The arrival of this bundle of joy may not necessarily bring happiness to every mother, as bills not covered by the NHIS pile up. For some mothers, they have to spend several days in the hospital without being discharged. The reason is simple: lack of money to settle their bills. We are at the Mamobi Polyclinic, where Rose Tete is attending her antenatal for her third child. She tells me Dr. Forson will this time save her some embarrassment.
So it's like when I was in the lumbar ward, I have to go, and then the nurses will give me something. Do you have this? I say no. Do you have this? I say no. So they will give me something. Then at the end of the day, when it's time for them to collect their money, I was not having it. So what happened is, when somebody came, maybe somebody comes there to visit me, and they say, oh, okay, take this for this, then I'll use it to support. Take this for this, then I'll use it to...
That's embarrassing, isn't it?
Yes.
So you didn't want this embarrassment again?
My dear, that is it.
Insurance and good, but Musa nim say insurance were whole, insurance in the whole. Musa in here sika.
Dr. Forson began Trimester Save less than 9 months ago, and the motivation is to save mothers the embarrassment of not being able to settle their bills after delivery, and midwives at the hospital also the frustration of dealing with such patients.
To be honest, this came about as a result of my interaction on the labor wards with midwives. And they are often painted black because they seem to be unaccommodating to pregnant women. But I realized that they actually are not to blame in many of the situations. They are responsible mothers, and they also have their lives to lead, and they suddenly have to manage this patient sometimes at 2 a.m. who have no funds, and some hospitals don't have any arrangement. And it's quite frustrating that a woman was pregnant for 9 months and arrived, as they say, with 10 fingers, with nothing to show. So I think that was my primary motivation, to solve this from the patient and then the midwife's perspective, so that this availability of funds to facilitate the process will be easy.
Africa is the leading continent where patients have to cough up about 40% payment of their bills.
I wouldn't single out Ghana, but I would say Sub-Saharan Africa in general. Out-of-pocket payments can rise up to 40% of the cost of having a child.
The platform makes women save towards their delivery either daily, weekly or monthly till their due date. The money is then saved in a Pan-African savings and loans account where women cannot touch it till after the 9 months.
What we are doing now is we are onboarding the pregnant women onto Quick. And the customers themselves set the target that they want. And then they break this down into how many times they want to save and how much they want to put down. So we lock it, we put it in. So you must deposit that amount towards your delivery. So this will meet your financial requirements at delivery. And what we do is we lock it so that you cannot withdraw, because we want to help them save.
To go to bank, I can't go, maybe the man is not there. So when I came to the hospital and they introduced this, I noticed and I thought it will help me, because even if I'm in my bedroom, I can withdraw money or do mobile money from it. And if I want to save too, so from now till the time I will give birth, I don't think I will have a problem, because right now when I started, when I check the account, I see I have something there.
So what happened to the NHIS?
So there are inefficiencies everywhere, and I wouldn't want to blame the NHIS necessarily, But even in facilities, there will always be out-of-pocket payments for certain things that NHIS doesn't cover. And as I've also mentioned, there are other costs associated with having children that NHIS can simply not cross into, And so I think that's where our value proposition is, and it is a very real value proposition.
So far, 70 women have signed on to the Trimester Save platform, and it's already making waves around the world.
From Uganda, there has been significant interest. They've been calling to us to come and set it up. I'm Ghanaian. I just wanted to hand in there before East Africa, who is known for all these innovation steps in.
That's right.
There's been some interest from Kenya as well. Then South Africa, for example, is undergoing a big, overhaul of their health system. They want to set up insurance, a new national health insurance system. So we've had some interest from there. And from far away India as well, we do have interest.
Startup has already attracted the United Nations attention.
UNCDF is the United Nations Capital Development Fund. What it focuses on is to make public and private capital work for the poor. And how do we do this? Through inclusive projects and programs. We support with technical and capital capacity to help poor people access financial services, to expand their opportunities and reduce their vulnerabilities. This explains our partnership with Trimester Save.
And the fintech is fully implemented. It's expected to reduce maternal mortality rate, especially in rural communities, which stands at 319 deaths out of every 100,000 deaths in Ghana. WHO standard is 216. In Ghana is 103 deaths away from the figure. Sierra Leone has the leading maternal mortality figures, standing at 1,360 deaths out of every 100,000 deaths.